Hey, joining us from Living Well Aesthetics, we have Dr. Jared Chapman talking about some things, some hormone replacement. Thanks so much for joining us today. And you know, we hear a lot about hormone replacement for women. So what do you like to recommend, and what would be the benefit for it?
Well, first of all, what are the signs and symptoms? And that's what I like to make patients aware of out there, that a lot of times we contribute hormone imbalance to other issues, and when in actuality we may be just dealing with a hormonal imbalance. So fatigue is one. Fatigue is a huge one. As an internist, when I would sit in my practice daily and listen to patients come in, at least 40 to 50 patients a day, one of the number one complaints, probably 70 to 80% of the patients, suffered from fatigue. The second thing I would say is just foggy thinking. When you don't have clarity of thought, can't find the words, or just feel like your mind is jumbled. Third thing is usually maybe a sex drive. Decreased sex drive is another complaint that patients have. Heat or cold intolerance, weight gain, especially around the belly. These are all signs and symptoms that could relate to hormone imbalance. Obviously, I believe in a thorough workup of the patient, and other things should be looked at, but at the end of the day, when everything's coming back normal, then we need to look at hormone imbalance as a possibility.
Yeah.
Here at Living Well, we do pellet therapy. So pellet therapy is basically a bioidentical hormone that has been compressed into a powder into the form of a pellet. We place this in the sub-Q tissue in the back of the patient, either at the upper part of the buttocks or in the lower part of the back, and it dissolves over time in that fat tissue where there's a lot of blood vessels, and basically that gets absorbed into the system and it gets utilized in the body as our hormone is made in our body. So there's not first pass through the liver. If you take something orally, it goes to the liver usually first and gets conjugated. This does not do that, so you get a more natural benefit from the hormone. I guess the next question would be that some patients have, well, is it safer than synthetic hormones? And I believe it is. I absolutely believe that bioidentical hormones are safer. Does that mean that they don't have risks? Absolutely not. And a risk-benefit analysis needs to be undertaken with each patient to determine if they're a candidate for hormone replacement therapy.
Yeah.
But overall, patients see a huge benefit in their quality of life when they do the hormone therapy. And I really think that it is highly beneficial, especially as a part of healthy aging.
We
don't have to just accept
let me ask you here too. Talk about the cost involved here as well for this treatment.
So the cost ranges from around $350 up to $700. For females, it's around $350. They come in every 3 to 4 months. For males, it's around $700, but they only come in twice a year. So it's equivalent to about the same price for both male and female. The females just come a little more often because the pellets are smaller and they need less and things like that. But overall, if you look at it, it averages about $100 a month. For the therapy, and it is phenomenal. It really does change people's lives for the better.
If someone wants to come in, have a consultation, and see if maybe this is what they need, how do they get everything started with you?
Actually, we have a symptom tracker on our website that's really nice for the patient to fill out. They can go to livingwellaesthetics.com, fill out the symptom tracker. It will email us that they have filled one out and that they're wishing to schedule a consult with us or discuss possible consult. And at that point, our staff will reach out to them and get them scheduled if they want to come in to further investigate this. Again, it is amazing. I personally have been doing this since 2013, and I would pick up pop cans if I had to get my pellets.
Dr. Chapman, thanks so much for sharing this with us and how to get some of that paperwork started. Great talking with you.
Thank you, Susan.